Well, from the feedback I've had, and I've used 111 myself on behalf of a service user, you suddenly get somebody answers the phone, and then you get referred to somebody else, possibly. The problem, as we see it, is that people are not necessarily being referred to see a psychologist or a therapist, which is what they want. And this is something of concern, and this is happening because there aren't enough people available. There aren't enough professionals available in the system.
Now, you say that the complement of professionals is lower than it has been for a while. How do you know this?
Well, we know again from hearing people who say to me, my psychiatrist has left. We talk to people in the system, professionals in the system, who tell us that this is happening, that so-and-so has left, that so-and-so has handed in the resignation.
But are they not being replaced?
Well, I know that there were 2 posts advertised on the GHA website, one for a psychologist and one for a psychiatrist, so that's great. I have heard that there might be more posts going. I don't know, because these things are not properly, the GHA website is not updated. There are lots of things that are out of date, at least in the mental welfare provision section. So I don't know exactly. I just know from what I hear, from what I'm told, that a lot of people, and over the last year, for example, a number of people that I know personally have left the system, and this is very worrying. The fact that people, for a number of reasons, either they don't have their contracts renewed, and sometimes this happens because they have challenged something that the system doesn't work, and perhaps they are seen as problematic, so their contracts aren't renewed. And also you have those professionals who are not happy to work in a system which doesn't work well and who leave. So this is a huge problem, because there is no continuity of care, which is ultimately what service users want.
Now, we know that a committee has been established to look at the mental health strategy. Do you not see any improvements, or do you not feel that improvements are in the pipeline?
Well, I'm sure there are. There are improvements in the pipeline. I mean, as I said we said in the PR that this is a 5-year strategy. We realize that we have to wait to see what is going to happen. But it's clear that if you're going to try to implement a strategy without investing more in the system, considerably more, is not going to work. And there are lots of things, before there were problems. There have been problems in the system for years, ever since it existed, and now we see more and more people it seems as if that they need medical help for mental health problems. So we need to invest. We need to look at it differently. We can't just see it as a very small minority need. It's not. There are many people who need many different kinds of support, many different kinds of professionals available, and the government needs to be prepared to invest in that.